Speaker, and I'd like to make a contribution in relation to the health worker accommodation notice of motion brought forward by the member for Bega. Firstly, I'd like to acknowledge the member for Bega, a highly respected specialist obstetrician and gynaecologist for 30 years, and the last 20 at Maria and Bateman Bay hospitals, and he comes to this House with great understanding of the health system, and prior to him, I'm sure, becoming a member of the Labor Party and becoming a member for Bega, he was a great fighter for health, advocacy for health, improving. Unfortunately now he's just sort of defending the government in relation to a lot of the things that they're not doing. And I can tell you, Mr Speaker, the things they are not doing, particularly around health worker accommodation. In terms of health worker accommodation, while there are, and we acknowledge even in the Tamworth electorate, there have been some health worker accommodation pods set up, which is gratefully received, but there's no one to use them. The problem is the health workforce is not there. There's no one to use that accommodation purely because, as the member rightly pointed out, the difficulty in recruitment. And he highlighted midwives, and even in the Hunter New England area of the Tamworth electorate, midwives are very hard to recruit too, and babies are being born outside of their home hospital. And when you want health services closer to home, that gets to the crux of what we're talking about. So, for example, a lot of those workers, we heard from the member for Northern Tablelands as well, not having a doctor at Maureen, not having a doctor at Inverell, and the Weewar Hospital still does not have an emergency services department. So these are some of the things that they're not telling you that's happening on the ground in rural and regional New South Wales. The Gunnedah Hospital, $53 million was given under the previous coalition government. That $53 million has been allocated to the hospital, but it's been shortchanged. There is no renal, there is no chemo or dialysis. And these are the things that our regional communities, as the member for Bega would know, you've got to have those services closer to home. We can't travel, a 200k round trip sitting in a passenger seat after you've had dialysis. It just doesn't work. So what happens is people will then choose the option not to receive health care. Whether it's chemo, whether it's radiation, they will choose not to accept those health options because of the difficulty and the tyranny of distance, and of course the separation from family and lack of support. And another issue that the member for Bega is well aware of is the Gunnedah helipad. The helicopter helipad has been closed because of a report that has not been tabled. For 7 years the helipad operated after a report was released to say that it could operate. Now all of a sudden they've closed it for reasons that we are still yet to be given by New South Wales Health. We have highlighted, along with Gunnedah Shire Council, the areas that need to be rectified, given the AW139 is a larger helicopter than the previous helicopter. There are areas, for example, where gas bottles can be fenced off. There are areas where trees can be trimmed. There are areas that will accommodate that AW139 given the high rotor wash when it does land. So the reasons given by New South Wales Health as to why this helicopter cannot land at the Gunnedah Hospital do not stack up. And there are about 15 valid reasons being given to your office as to why that helipad should reopen. And I can tell you, to land 6 or 7 k's from the hospital to the airport and back again, and member for Bega, minutes matter, seconds matter. And when you need to get someone to a much larger hospital where specialist care is needed, that helicopter does its job in rural and regional New South Wales. And I ask the member to take those comments on board.